I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with Whitford Thomas Group, speaking to you today about bipolar characteristics. Bipolar characteristics. Bipolar is a disorder. Years ago we referred to it as manic depression. Today it's just bipolar. Bipolar is a mood disorder. It means the mood generally tends to be a depressed mood, and oftentimes associated with the bipolar, which is why they call it bipolar, is a manic state. So the characteristics of a bipolar disorder would be symptoms associated with depression and oftentimes mania or manic as well. So if we look at depression first, the symptoms associated with depression are certainly in bipolar the same with any other depression. Oftentimes depression comes in a form of inability to think clearly. Generally, when you look at depression, you're thinking about two pieces. One, kind of a hopelessness and helplessness. And so if the hopelessness piece, if people view that there's no hope for change in the future, as well as that there's not anything they can do about it, you tend to see these symptoms at that time, again, with those type of thoughts. If we look at mania for a moment, mania tends to be an elevated mood, where depression is obviously a decreased mood. Mania tends to be an elevated mood. Probably the most common characteristics of mania are kind of an elevated, not just elevated mood, but the kind of a grandiosity, kind of an escalated or exaggerated self-esteem. Oftentimes with mania, we tend to see folks, individuals, engaging in kind of high-risk behaviors. Some folks become almost hyper-focused on certain tasks. Mania, you tend to see pressured speech. With mania, you tend to be oftentimes people have difficulties with boundaries. So bipolar is depression and mania, and it's a very complex disorder, which really would require a lot more time to speak to. I'm Dr. David Thomas, speaking to you about bipolar characteristics.